The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, medical, technology, and treatments. This is Rex on Call. Welcome to Rex on Call live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today we're talking about bariatric basics, weight loss surgery, and better health. If you're watching us live and have questions about weight loss surgery, call 919-744-3876. Your questions may be answered live on our program by our experts. The physician answering your question today is Dr. Dustin Bermudez from Rex Bariatric Specialists and a registered dietitian, Mary Gray Hutchison, also from Rex Bariatric Specialists. Again, to call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we're streaming live on WRAL.com, you can email us your questions using rexoncall@rexhealth.com. Find us on Twitter and send us a message at RexHealthcare, #RexOnCall. And while you're calling in with those questions, we'll share the most recent statistics about obesity in America. According to the Centers for Disease Control and Prevention, more than a third of U.S. adults are obese. This leads to obesity-related conditions such as heart disease, stroke, type 2 diabetes, and certain types of cancer. The fact is that obesity is the second leading cause of preventable death after tobacco. Well, we want to introduce you to a Knightdale man whose commitment to getting healthier has led to lifelong changes that started with his decision to get weight loss surgery. Michael Ellis is 48 years old, but he feels like a new man. That's because just 2 years ago, Michael looked like this.
I was thinking like, wow, what happened? You know, how did you allow yourself to get that way?
When he reached a 6X t-shirt, he knew he had a problem. His top weight, 454 pounds.
And that's when I saw the commercial on TV with Rex Bariatric, and that's when I made a decision.
A decision to go see Rex Bariatric surgeon Dr. Lindsay Sharp.
Certainly there's an increased risk of early mortality when your BMI is over 40, and the higher your body mass index gets, the greater that risk is.
Dr. Sharp put Michael on the road to a healthier lifestyle, more than just recommending surgery, but also diet and exercise.
No sweet tea, no Mountain Dew and Coke, and then starting to exercise 3 to 4 days a week. I noticed the weight was starting to fall off.
6 months later, Michael lost 50 pounds and was ready for gastric bypass surgery.
We make a small stomach out of the upper portion of the stomach, and then we divide the small intestine downstream and bring it up and attach it to that pouch. Following
the surgery, Michael quickly lost 100 pounds.
So I was like, wow, you know, if I can lose 100 or something, I can go for 200. Kept working out and followed the program, and before you know it, I lost over 200 pounds.
Today, he weighs a fit 230 pounds and even mentors patients considering surgery.
Just like me, they were skeptical and they were scared and didn't want to do it. So I helped coach them through the whole process.
A process he calls life-changing. He exercises several times a week.
Tilapia and sauteed green beans.
And he and his wife Katina watch what they eat.
High protein, low fat, and really too little to no sugar. I'm upset with myself because I should have done it years ago. I could have been more involved with my kids, so my life has definitely took a turn for the better.
Wow. Now remember, Michael said he got up to a size 6X t-shirt size. Well, now he says he's become a shopaholic because he can shop in regular trendy stores. He looks great. Well, Dr. Sharp mentioned during the interview just how far bariatric surgery has come. It's now a laparoscopic surgery, so it's minimally invasive. And patients are up on their feet the same day as the surgery, and most patients stay just 1 to 2 days in the hospital. Now joining us are Dr. Dustin Bermudez and Mary Gray Hutchison from Rex Bariatric Specialists. So nice to have you here. Thanks so much.
Thank you for having us.
All right, so first question, Dr. Bermudez, Michael had gastric bypass surgery, but there are other weight loss surgeries available. Can you talk about some of those procedures?
Sure. As you mentioned, bariatric surgery has evolved over the last several years, and right now we offer patients 5 different kinds of operations.
Wow.
And they really vary depending upon kind of what your starting BMI is, what your medical conditions are going into the operation. Because what you want to do is you want to pair the aggressiveness of the operation with the severity of your obesity or conditions that you have. So
is there like a starting or beginner level maybe per se?
I guess in a sense, many would consider the band the least invasive operation. I will say that the outcomes are nowhere near as good as the other operations, and I think that it is not as popular as it was, say, 10 years ago.
This is the gastric banding procedure right here. And this is where could you describe that surgery a little bit?
Sure. So the surgery is sort of a simplistic surgery, and I think in many ways it may oversimplify kind of the underlying metabolic disorders people have that lead to obesity. But what you can see on that, picture there is that you have a piece of essentially plastic tubing around the stomach. And in that tubing there's a balloon that can be inflated or deflated through a port under a patient's skin. So if you're not a fan of needles, it's not the greatest operation to get. But essentially what you can do is as the size of the balloon increases, the aperture through the stomach shortens
so you
and
get
smaller.
Fuller quicker?
Exactly right.
Okay.
So,
all right.
And so, you know, for some people it works. I know there's a lot of high-profile people who have
Governor
been on,
Christie has had this
exactly
done,
right.
and some other celebrity-type folks.
Absolutely. But I would say the outcomes in general are nowhere near as good as the other operations.
Another one that I've heard a lot of talk about is the sleeve gastrectomy.
Yes. So the sleeve actually is the most popular bariatric operation now, at least in the year 2014 it was. It, in many ways, has become incredibly popular because of its simplicity. It is essentially just stapling the majority of the stomach off, so you end up with about 80% loss of your stomach. And that not only changes the reservoir of your stomach, so you're actually able to eat less, but it changes the kind of hormonal basis of your desire to eat and how your metabolism functions.
Okay. And then the other one, the duodenal switch, is another one that you do a good amount of?
Right. So the duodenal switch is, I would consider, the most aggressive bariatric procedure that exists. It is a very complicated operation, and very few surgeons do it, although it is becoming more and more common. In general, the duodenal switch is something that you reserve for patients who have a BMI greater than 50, or patients who have very severe insulin-dependent diabetes, because it gives you the greatest chance of cure of your diabetes, well over 95%. But it's essentially giving you a smaller stomach, like a sleeve, and then you bypass a large portion of your intestine, which changes the way your body metabolizes your food.
Okay. Now, Mary, I want to bring you into this. When you guys get a patient at Rex Bariatrics, you've got them for life, essentially,
yes.
Right? So tell us
Absolutely.
how that process works. It's not a quick fix like some people think.
No, it's not. So we have a multidisciplinary program where we bring the patient in, they come in for nutrition counseling, and so we work on dietary and behavior changes, including getting adequate protein, adequate vitamins and minerals, fluids, those kinds of things. And so we start them there, but our program goes on after surgery as well. You know, we work on those before surgery, and then after surgery we offer support groups, cooking classes, grocery store tours. We really have tried to expand our program to meet our patients' needs as they grow further out from surgery.
Because there are cases where people will have a weight loss surgery and then they end up gaining the weight back. And isn't that because of the lifestyle choices that they're not correctly making?
It is. I mean, because it's lifelong changes that they need to make, not just changing for a month until they have surgery and then all of a sudden they fall back into their old habits. We want them to establish those habits for life. And part of that's having support, not only at home, but also through your medical practice.
Okay. Dr. Bermudez, who in general would be a good candidate for weight loss surgery?
I'd say that the best candidates for people are people who at least have a BMI of 35. And in general, once your BMI is at 40 and above, your life expectancy actually drops significantly, whether or not you have medical conditions, regardless. And so I think once you're at that stage of your life and you're battling obesity, I think it's really important you consider different options other than just trying to do dieting and exercise. So I would say any patients with a BMI above 40 should consider it. I think if you have a BMI of 35 and you have a medical condition like sleep apnea, then you will oftentimes qualify for surgery. But I think oftentimes bariatric surgery is actually underutilized in the U.S., and I think more people would benefit from it.
Well, this brings us to Diane has a question from Smithfield. Does Medicaid or Medicare pay for bariatric surgery?
So Medicare does cover bariatric surgery.
Medicare.
Medicare,
Okay.
right. So for the elderly, that does, or I'd say over 65, that does cover bariatric surgery. Medicaid is a bit more controversial in the state of North Carolina. It's not, oftentimes not covered. But.
Okay, and then regular insurance, oftentimes if you have maybe a comorbidity and 35 and above, they might come in and pay for some of that as well. Some people's will cover it.
Right, I think that I would say that we've been finding more and more insurance companies recognize the value of bariatric surgery. And so I think if you have private insurance, you may want to call your carrier and see if that is an option.
Okay. Well, we are going to be right back after the break to answer your questions. Just give us a call or send us an email. Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on weight loss surgery. If you have questions for our experts, call in now at 919-744-3876. If you're watching us as we stream live on WRAL.com, email your questions to rexoncall@rexhealth.com and find us on Twitter. Send us a message at RexHealthcare, #RexOnCall. So let's take some of our questions right now. One woman is calling in from Durham, Graylee, and she wants to know, she had prior gastric bypass in 2003, and she's looking at a revision. What are her options, and what does that mean even?
So a revision is basically taking one bariatric procedure and either fine-tuning it or converting it to another operation. I think that we are seeing a lot of patients who need revisions because oftentimes patients get an operation that may not have been the right operation to start out. You know, oftentimes people will get a band, for instance, but their BMI is 60. It's incredibly unlikely that you'll be able to get down to a healthy weight with just a band at that starting BMI. So if you already have a gastric bypass, I would say that it is, your options are limited. Some people talk about shrinking your pouch and trying to make that smaller. I would say the outcomes from that are very poor, and they don't really give you significant weight loss. The other option is to convert you over to what's called the duodenal switch, and that is a very major revision, but for many people that is a good option, helps them to regain their weight loss.
Okay. Mary, is there an age limit for someone pursuing weight loss surgery?
There actually isn't. You know, we definitely want them above 18 and want to assess their maturity level there, but in terms of our upper age limit, we don't have one. It's really dependent on the individual and their health.
And if they have these other comorbidities, one lady, Carolyn from Goldsboro, wants to know, if she were to go for a consultation to see about doing weight loss surgery, could it possibly help her high blood pressure or diabetes?
Oh my goodness, absolutely. That's why a lot of patients pursue bariatric surgery, because with reduced weight, you can reduce your blood pressure and certainly gain control over diabetes for a number of different reasons. I mean, weight loss, but then there's the hormonal component of it after surgery that also plays a role in remission or cure of diabetes.
Okay, so we talked about who an ideal candidate might be for weight loss surgery. Once you've sort of made up your mind saying, okay, I want to investigate this further, what's the first step?
I think with our practice, the first step would be to call us and make an appointment to see one of our surgeons. One of the first steps, though, is we have a new patient seminar for patients to really learn a little bit more about bariatric surgery, because this 30-minute segment here is not going to be enough to really explore all the different options, all the benefits, and the potential risks with surgery, which I would say are minimal. But in general, having a new patient seminar and contacting us would be the first way to go.
Okay. Does insurance, if you have private insurance that may pay for it, if you have all the things line up correctly, is there a requirement of steps that must happen before insurance will say, yes, okay, you can get this insurance or you can get this operation?
That's another good question. You know, the insurance aspect of this is very complicated because everyone wants to know, am I going to be covered? How much am I going to have to pay? How long is the process going to be? And it really varies upon your insurance plan. So I think one of the first steps, along with calling us to set up a new patient consultation, would be to talk to your insurance carrier and see what your requirements are. Some insurance carriers like Medicare require you to do 6 months of physician-supervised weight loss. Other insurance carriers like Blue Cross Blue Shield of North Carolina do not have any requirements in terms of a preset time period you have to wait before surgery.
Okay, all right, all good things. Well, coming up, we will answer more of your questions on weight loss surgery. Just call 919-744-3876, or you can email us your questions to rexoncall@rexhealth.com. But before we go to break, we want to tell you about a free event coming up this Friday, April 24th. It is the 2015 Blood Cancer Conference, a collaborative event for patients and families in the Triangle. This free conference will be held at the Solution Center in Durham from 8:30 in the morning to 3:30 in the afternoon. Now, space is limited, so please call 919-367-4100 to register, or you can go to rexhealth.com and search Cancer Center Events. Welcome back to Rex on Call, here live on WRAL. To reach us, call 919-744-3876 or email us your questions to rexoncall@rexhealth.com. We're taking questions about weight loss surgery. But first, before any surgery, it's important to have solid support systems, family and friends who will give you the encouragement you need before and after the procedure. Well, you're about to meet a couple who have the best support system ever, each other. Jonathan and Audrey McCoy's love story began almost 20 years ago. They've been happily married for 13, but over the last 8 months, their lives have taken a joyous downward spiral.
We've only known each other on the heavier side, and now that we're losing weight together, it does form a brand new closeness.
Jonathan is the football coach at Broughton High School. He himself was an offensive lineman in high school and college.
Offensive lineman, if you weighed under 300 pounds, it was hard for you to succeed in college.
But after his weight ballooned to 556 pounds, Jonathan had duodenal switch weight loss surgery in August at Rex Bariatric Specialists.
We needed to change our lives together since we were going to be together.
His wife Audrey underwent the same procedure in December.
It was so nice that Jonathan and I could do it together as a team and really support one another in the journey.
Already the McCoys are seeing the results. Jonathan has already lost 200 pounds. His ideal weight?
Probably between 190 and 200. So the process, I'm averaging about 25 pounds a month that I'm losing.
Audrey lost 70 pounds in 5 months and no longer has high blood pressure.
I started out at 320 pounds at my heaviest, and I remember feeling like I was drowning in my weight. My goal is to get down to about 130 pounds.
The McCoy's bariatric specialist, Rex's Dr. Peter Nong, says the duodenal surgery is ideal for heavier patients because it's a combination of 2 weight loss procedures.
One is to make the stomach smaller, and that's what a sleeve gastrectomy is. And we then make the intestine shorter.
Changing the hormones in the body.
You are no longer hungry for a very significant period of time.
The McCoys say their cravings are gone. And in an amusing twist, so are their wedding rings.
That's the thing, we can't wear our rings now. I tried to put mine on, 2 weeks ago? And it just fell. I just put my hand and just fell.
They plan on getting their rings sized down. Just another part of their weight loss journey together.
I didn't want a new husband, but I got a new husband.
They are the cutest couple. Congratulations on their journey so far. Now, Jonathan says this football season, he's looking forward to buying a regular-sized overcoat and tracksuit, and he no longer needs a belt extender on the plane when he flies. And after Jonathan reaches his ideal weight, he's going to undergo another kind of surgery to reduce loose skin. So that leads us into another caller who actually said Esther from Wilson had gastric bypass in 2012, has lost a ton of weight, and has a lot of flabby skin. What's the next step?
Yeah, I suppose that excess skin after surgery is one of the downsides to bariatric surgery. I will say that losing the diabetes, losing that tremendous amount of weight, losing your blood pressure, gaining a new lease on life is really what this is all about. But excess skin is a real issue, and I would say that most of our patients do not end up pursuing that. You know, partially it's oftentimes expensive because most insurance carriers do not cover it. But there are certain ways to minimize it. I would say making sure you build muscle after surgery and not just do cardio is helpful to minimize the excess skin. And I would say that in general, the younger you are, the less likely it is you'll have excess skin. In general, men, sorry Sharon, tend to have a little more elasticity to their skin than women. But
Okay, so let's also talk about what we've got sitting here. Probably at home you're like, are they eating lunch? Mary, let's talk about portion control, because that's a big part of what you are addressing with all of these patients. This is the lifelong change.
Oh, absolutely.
We're all crazy with the amount of food we're eating. We're supersized, right?
Absolutely. Well, I mean, this is our dinner plate, and our dinner plates these days are the size of serving platters in the 1950s.
Yeah, so let's hold it up here. So that's crazy.
Yeah, it's enormous. And what do we do? But we fill it. Yeah. Because that's what we were taught to do, and we clean it.
And this is what we should be actually eating,
yes,
right?
This is what we should be eating. And on this plate, what you'll see is half the plate is non-starchy vegetables, so low calorie, high nutrient dense foods, and then just a quarter of your plate is the starch, whereas Americans, we love our starch, and so that tends to take over our plates in general. And then just a little bit of protein, so 3 to 6 ounces is reasonable.
About like the size of your fist or something like that.
Yes, that's a common one.
Here, let's take a look at the fish.
So that's 3 ounces of fish. So
pretty appetizing, isn't it?
Most of us would eat more than that, though, particularly if we were eating out at a restaurant. I mean,
yes. Maybe we should start splitting entrees with our partners or our friends when we go out.
Yeah,
it would be cheaper.
And it would be cheaper, right?
But studies definitely show even when you're eating out that it's 2 to 3 servings, normal servings that you get when you're dining out.
Plan on the doggy bag.
Exactly.
Okay.
Exactly.
Well, we will have our final rounds of questions right after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. One thing that came in that is really curious, what about pregnancy after weight loss surgery?
I think that's fascinating, because I think that bariatric surgery offers a lot, especially to young women. Oftentimes younger women have a more difficult time getting pregnant, so bariatric surgery makes it a lot easier. It can cure polycystic ovarian syndrome, which is one of the most common causes of infertility in young women. And then, in general, it makes the pregnancy process healthier. There are fewer risks of eclampsia, preeclampsia, and HELLP syndrome.
And gestational diabetes, that could all be cured?
Absolutely. Wow. So it makes it safer to get pregnant as well. And then, actually, there's been some recent studies that have demonstrated that children born of mothers who've had bariatric surgery are actually less risky, or at less risk of becoming obese themselves.
Amazing. All right, well, as always, please consult with your physicians about any health concerns you have. And if you're looking for a doctor beyond today's show, or you need direct referrals, you can call Rex HealthNet. That's Rex's free telephone information service. The number is 919-784-4490. And we want to thank our phone bank for taking all the calls here, and as well as our experts. And you can join us next month for our Rex on Call. Our topic is better health for babies and expectant moms. That ties in nicely. Perfect. You can email your questions ahead of time to rexoncall@rexhealth.com, and then be sure to join us on Monday, May 18th at 1 o'clock. And before we leave you, we have a wonderful volunteer opportunity. Rex is looking for volunteers to help with the annual Rex Hospital Open. It's an official stop on the PGA Tour's web.com tour, and this year's tournament is at Tournament Players Club, Wakefield Plantation in Raleigh from May 25th to the 31st. Volunteers are the backbone of this terrific golf tournament, so to learn more about becoming a volunteer, visit rexhospitalopen.com/volunteers. Thanks again to everyone, and we will see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.